When I first started receiving the chemotherapy treatments, it was a very long day. Lots of experience of being tired. The nausea and vomiting prevented me from doing the things that I wanted to do with my family. I couldn't attend church. I couldn't go to ball games, social functions that I normally would do with my family.
Mary isn't alone. In our survey of cancer patients, 95% of the patients that experienced nausea and vomiting said that it impacted their daily lives at some point. CINV can have a significant impact on patients' daily activities. They change their eating habits, they stop exercising, they cancel plans, or they call in sick to work. In a survey of 400 patients receiving chemotherapy recently conducted by HOPA and Eisai, 83% of patients experienced CINV and thought it was something that they had to live with. I remember a time when CINV was difficult to treat. In today's cancer therapies, with the right guideline-driven treatments, CINV may be prevented.
Watching my mom go through the nausea and vomiting, obviously that's hard to watch. There was a time when Mom and my brother Tim and I met with Mom's doctor and talked about addressing her nausea and vomiting because we didn't feel like she was doing it as well as she could have. And we wanted to have that discussion.
Over time, I became more comfortable in discussing my needs with my healthcare team as well as my family. My family encouraged me, obviously, to speak up for myself when I was trying to suffer in silence.
If they're experiencing CINV, they should talk to their healthcare professionals. Talk to your pharmacist. Your pharmacist can work with your oncologist and develop a treatment protocol based upon guidelines that may prevent future nausea and vomiting.
Patients don't necessarily bring up the topic of chemo-induced nausea and vomiting on their own. Often you have to, as the provider, ask those questions, make them feel comfortable discussing their symptoms, when they're nauseous, when they're vomiting, and let them know that you expect them to tell you what their symptoms are.
HOPA and Eisai believe that prevention of CINV is something that's very, very important. Both organizations are working to help patients get through their chemotherapy process. So we're working to bring together resources all in one place that can help encourage that communication between patients and healthcare providers. For more information about the Time to Talk CINV campaign and to learn more about preventing CINV, visit timetotalkcinv.com and hoparx.org.